Hi, I'm Dr. Dan Carlucci. I'm a cardiologist in Central Massachusetts and a member of the Reliant Medical Group. I'm also a proud board member of the American Heart Association of Central Mass, and I'd like to thank you all for participating in this year's Heart Walk. It's an unusual event, it's a virtual event, but nevertheless, it's a very special event for a great cause, and I thank you for participating. I'd like to speak to you today about two topics. The first is how do we maintain good heart health amidst this COVID-19 pandemic? Because it's been a challenge for many of our patients. The second topic is a brief introduction to the American Heart Association tool called My Life Check, Life's Simple 7. This is a very nice interactive tool that you can access online to assess and control 7 modifiable risk factors using tools put together by the American Heart Association. Before I talk about those two topics, I'd like to give a huge shout out to my colleagues across Central Massachusetts who, for the last 3+ months, have been caring for very sick COVID-19 patients, some of these patients on ventilators, for over 2 weeks. My colleagues include pulmonologists and critical care physicians, emergency department doctors, infectious disease specialists, hospitalists, nurses on the front line, and all staff members on the front line. Thank you. You've done a great job. Getting back to the topics, maintaining good heart health amidst COVID-19 has been a challenge. I think as physicians, we've done a great job at getting the message out that SARS-CoV-2 virus, which accounts for the COVID-19 disease, is a very serious virus, especially to those of us and our patients who are at increased risk with heart disease, stroke, diabetes, congestive heart failure, obesity. We've done a really good job of getting the message out, of reducing the spread of the virus, but we've also created sometimes an inappropriate sense of concern among patients to seek care when it's really needed. Our emergency departments have seen fewer presentations of patients with heart disease and stroke, with heart attack. Some of these patients are suffering their conditions at home when they should be in the hospital cared for by specialists. Our hospitals and emergency departments, urgent care centers, outpatient centers are taking all precautions needed at this time to be safe for patients to come back in. So please use your good judgment. If you are having symptoms suggestive of a heart attack or stroke, don't waste time. Seek attention, call 911, come into our facilities, they're safe. The second topic is the introduction to the American Heart Association tool called My Life Check, Life Simple 7. Again, this is an interactive online tool designed to improve blood pressure control, cholesterol control, blood glucose control, and to encourage people to get active, to eat better, to lose weight, and to stop smoking. It involves signing up, registering, answering several simple questions, generating a heart health score, and then using the information and the tools designed by the American Heart Association to improve those 7 controllable risk factors. So it's a wonderful, simple tool. It's easily accessible, and I would encourage everyone to go online and use it. Thank you again for allowing me to speak to you on these two topics. Thanks again for participating in this year's Heart Walk, and I wish you all a healthy spring, summer, and fall as we go forward. Hope to see you again soon. Thank you.